What is the connection between thyroid disease and gut disease? We asked the pharmacist, Dr. Izabella Wentz, on the Functional Forum.
So Izabella, I want to start with you. So Izabella is the author of a New York Times bestseller, and it's on the thyroid. It's called Thyroid Root Cause. But Izabella, you pretty much talk about the gut all the way through the book. So can maybe you explain why you got so off topic on your book?
So my big thing is looking at the underlying root cause of Hashimoto's, which is the primary reason for most thyroid conditions.
Oh, sorry.
So looking at Dr. Alessio Fasano's work, Dr. Alessio Fasano has found that there are three things that need to be present in every autoimmune condition, and that's going to be the genetic predisposition, the right kind of triggers, like Dr. Jill talked about, and then the third piece of the puzzle is intestinal permeability. And so my personal experience with Hashimoto's was that I was diagnosed myself in 2009. Prior to that, I was never interested in the thyroid. And one of the things that happened before I had Hashimoto's is that I was diagnosed with irritable bowel syndrome. And so I found that with myself, in reversing the condition, I had to really address my gut first. And then I found that time and time again with clients over and over again. So, whether it's dysbiosis, different types of parasitic infections, food sensitivities, nutrient depletions, different things can contribute to the intestinal permeability. And oftentimes, really focusing on that is going to help a person with thyroid symptoms eliminate those thyroid symptoms, reduce thyroid antibodies, and in some cases, save their thyroid gland.
That's awesome. And as a doctor of pharmacy, I'd just love to know what role you see pharmacists in general playing in this medical evolution, because we've got coaches, we've got MDs, we've got all kinds of other providers here. As a pharmacist, I know that there's a yearning from some of them to get involved. How do you see that as sort of a leader in this space?
James, that's a wonderful question. And I think if we're going to make a big change in functional medicine and natural medicine, we all need to come together and work at the top of our practice, work at the top of our scope. And so pharmacists have so many different opportunities to address patient care. So functional trained pharmacists can work as consultants like I do, or if they're working in a pharmacy setting, they can start looking at nutrient depletions, drug-induced nutrient depletions. They can start recommending nutrition therapy to their patients that's well within the scope of practice of pharmacy. And some other pharmacists, may have advanced training and they may be able to look at interpreting some functional medicine tests as well as setting up treatment plans. So definitely for any pharmacists listening, I highly encourage you to get involved because we need you out here and we need the help.
Awesome.
Thanks so much for watching, and for more great clips like this, please subscribe to our YouTube channel. I've created a special free video just for you. It's called the 5 Steps to Becoming a Leader in Your Wellness Community, and it'll give you some of the starting points on how to position yourself as the leader in your zip code of your health community. All you have to do is click on the link below.